Welcome to This Explainer. I'm super excited you're here because today we are embarking on a really fascinating medical detective journey. We're literally peering deep inside the human body to investigate the, honestly, incredibly complex plumbing of the liver. We're going to explore exactly how doctors track down these hidden vascular blockages, and we'll decode one of the absolute most mysterious and severe conditions in hepatology, Budd-Chiari syndrome. So get ready because the vascular landscape we're about to navigate is just absolutely incredible.
Okay, let's dive into this. Liver surgery is intense, right? And it really immediately establishes the incredibly high stakes of hepatic health. Your liver is essentially this massive, highly efficient filter for your entire body, and it relies on a super delicate, complex network of inflow and outflow vessels just to keep everything running smoothly. When issues pop up in this invisible vascular plumbing, when you get, say, a biological traffic jam, the consequences can be pretty dire. So detecting these hidden blockages before they cause catastrophic damage, that's literally one of the most critical challenges in modern medicine.
To solve this medical mystery, here's our quick roadmap for today's explainer. Number 1, mapping liver vessel diseases. 2, ultrasound, first-line defense. 3, decoding Budd-Chiari syndrome. 4, acute versus chronic presentations. And finally, 5, tracking the underlying causes. All right, let's jump right into section 1, mapping liver vessel diseases. We're just going to quickly set up the wide scope of vascular conditions we're dealing with today.
You know, the liver's vascular network can suffer from a surprisingly huge array of blockages and malformations. It's not just one disease, it's an entire landscape of them. You've got portal vein thrombosis, which messes with the main inflow. You have congenital vascular malformations, portosinusoidal vascular disorder, or PSVD, and diseases of the hepatic artery itself, like aneurysms. And of course, the big one we're focusing on today, Budd-Chiari syndrome. Think of all these as just different types of traffic jams happening on different highways, back roads, and off-ramps inside your liver.
So how do we actually see these invisible traffic jams? Well, that brings us to section 2, ultrasound, our first-line defense. So the crucial point here is this staggering number, greater than 90%. When clinicians even suspect a vascular liver disease, the absolute first-line imaging technique is ultrasound, specifically color Doppler ultrasound. And why is that? Because it boasts a staggering sensitivity of over 90% for detecting thrombosis, basically blood clots. Plus, it's completely non-invasive, no radiation, no major procedure. Yet it acts as this remarkably powerful window straight into the flowing blood of the liver. It's a total game changer.
Now, the systematic approach doctors use might look like an incredibly intimidating flowchart at first glance, right? Just filled with clinical decision trees and diagnostic forks in the road. But I want you to look at it not as some complex schematic, but simply as a detective's magnifying glass. This is the exact step-by-step methodology they use to hunt down a blockage.
Let's actually break that intimidating flowchart down into 3 really logical steps. Step 1 is B-mode imaging. This is basically where the detective asks, hey, can I even see the pipe and is it the right size? Then step 2 brings in color Doppler. Now we're looking at the blood itself. Is there flow present and is it moving in the correct direction? Finally, step 3 uses spectral Doppler. This is the precision tool to analyze the actual flow pattern and measure the speed of the blood. It's such a brilliant, simple progression when you think about it. Find the pipe, check the flow, measure the speed. If anything at all is off, boom, you found your culprit.
Okay, now that we know exactly how to look, let's zoom in on a very specific, incredibly high-stakes medical condition for section 3, decoding Budd-Chiari syndrome. Time to decode the mystery.
Budd-Chiari syndrome, or BCS, is essentially a massive plumbing disaster inside the body. By definition, it is the obstruction of the hepatic venous outflow. Basically, the liver is desperately trying to drain blood back to the heart, but the drain is completely blocked off. And here is the real kicker. It's defined this way regardless of what actually caused it or where exactly the blockage is located. If the outflow is obstructed, you have Budd-Chiari syndrome. And that resulting backup pressure, it is going to severely damage the liver.
And this brilliantly illustrates exactly what we're talking about here. On this angiogram, you're looking at visual evidence of a massive outflow obstruction. Notice that crazy, chaotic, almost spiderweb-like network of vessels on the left side? Those are collateral vessels. The body is literally desperately trying to build new detours and backroads because the main highway is totally closed off. This image just perfectly captures the sheer physical reality of the syndrome.
Now, as severe as it is, we do need to understand the epidemiology. BCS is incredibly rare. I mean, we are talking about an incidence rate of roughly 1.5 per million people a year, and a total prevalence of just 4 per million. If you do the math, that is a microscopic fraction of the population. What's also really notable here is that it disproportionately affects women, with a female-to-male ratio of 7:3. So it might be a rare needle in a haystack, but its clinical impact on those specific patients is absolutely profound.
Because it's so impactful, we really need to know what it looks like when a patient actually walks through the door. This brings us to Section 4, acute versus chronic presentations.
This complex syndrome actually presents in two dramatically different ways. On one hand, you have the acute or fulminant form. Now, this happens in only about 7% of cases, but it is explosive. We're talking a sudden, severe onset with intense pain, an enlarged liver, sudden fluid buildup, and often even kidney failure, because the three main hepatic veins are just suddenly blocked. But on the other hand, you have the chronic or subacute form. Surprisingly, this is actually the most frequent presentation. It's insidious. The onset is way slower, patients initially have very few symptoms, but over time their liver function slowly impairs and they develop severe portal hypertension.
Because the chronic form is so slow and the acute form is so violently sudden, making a clinical diagnosis based on symptoms alone is notoriously difficult. So what clues does our medical detective actually look for? Well, you'd suspect BCS if a patient suddenly develops ascites, which is fluid buildup in the abdomen, along with upper abdominal pain. A massive clue is if that fluid is unusually high in protein. You'd also look for it in any patient who has unexplained chronic liver disease, or maybe someone developing liver issues who already has a known thrombogenic, clot-forming condition.
Let's move on and see how this builds our final picture in Section 5, tracking the underlying causes. We know what Budd-Chiari is and exactly how to spot it, but we need to start tracking the actual triggers of these massive blockages.
When researchers look for the underlying conditions causing these blood clots, hematological and systemic conditions are the major accomplices. In fact, a massive 41% of Budd-Chiari cases are linked to underlying myeloproliferative neoplasms, which, if you're not familiar, are a group of slow-growing blood cancers. Following closely behind that, 35% of cases actually test positive for a specific genetic mutation called JK2V617F, which basically causes the body to produce way too many blood cells. And another major external trigger? Recent oral contraceptive use is linked to 22% of these cases. So you see, it's almost never just a random clot. There's almost always a hidden trigger making the blood too thick.
And honestly, that list of triggers is a massive, complex web. Beyond the top offenders we just saw, doctors have to screen for a huge array of genetic deficiencies, things like protein S and C deficiency or factor V Leiden. But it doesn't even stop there. Autoimmune diseases like rheumatoid arthritis and lupus can completely set off this plumbing disaster. Even toxic exposures and certain chemotherapies like oxaliplatin can damage the vessels and lead to an obstruction. It really takes a true detective to trace a blocked vein in the liver all the way back to a random genetic mutation or an autoimmune flare-up.
We've seen how a highly structured approach using ultrasound can unravel the incredibly complex, high-stakes mystery of Budd-Chiari syndrome. But as technology rapidly evolves, I really want to leave you with this thought to ponder. With such an intricate web of vascular plumbing and so many hidden, microscopic triggers, how might the next generation of non-invasive imaging unlock even earlier, proactive detection of these rare syndromes before the blockages even occurs? It's a totally fascinating frontier for medicine, and I really hope this explainer gives you a much deeper appreciation for the incredible diagnostic work happening every single day. Keep learning, keep questioning, and I'll catch you on the next one.